I had been dealing with pain for 8 months, and the doctor said it's shin splints. She said it's sciatica, and I said, no, this is different. I didn't know what bone pain was. The hardest part for me was knowing if I was getting the right treatment, and so it was scary, not knowing who to ask, not knowing where to go.
And I was diagnosed, and it kind of stripped all of that. I was in charge of everything, and I became in charge of nothing.
When I was newly diagnosed with multiple myeloma, I would just blindly follow doctor's orders. I wouldn't know what questions to ask, what records to keep, or what treatment options were available to me.
One morning I woke up and I didn't feel good, and this was after playing golf on Sunday. Monday morning I'm on life support for the next month, and it happened that fast. And I'd never been sick a day in my life.
When I first got that horrible news that I had myeloma, it was like, all right, well now what? Who do I call? Where do I go? And it was overwhelming. But it was just not that easy to come up with where do I find trusted information, especially where do I find information regarding how do I get the support from a true expert in myeloma, because we know how complex this disease is. You got to have that.
But it was totally unexpected. As it is for everybody. I did, I think, what most everybody does. I went to a general oncologist. He was treating, I think, 5 myeloma cases per year. And he made the mistake of saying, don't go up to that cancer center up the street because they'll have you doing tandem transplants. So we called that guy, and he was treating 500 myeloma patients. So I ended up being treated by a myeloma specialist, fortunately. There are over 120,000 living myeloma patients in the United States right now. And I think our experiences are pretty much the same. So I just wonder why it's so hard getting the diagnosis and then getting up to speed on what you should do to manage your care. But the decisions that you're making at the very beginning are so critical to your long-term outcomes that it just baffles me that every myeloma patient has to reinvent the wheel and start at the same time point and experience the same frustrations. It just doesn't make sense to me.
In the few days after Jenny's diagnosis, we had to make a critical choice on her treatment. We had heard that Jenny's best shot at a remission or possibly a cure was this first treatment. But we were making this decision in a vacuum. We were frustrated. We didn't have the information, and even the experts disagreed on what the best treatment path was. Our question was, why wasn't there a platform or app or a system that had already done this work for us, that gathered information and patient stories and helped us make this critical decision?
When I was diagnosed, what I really wanted to see was all myeloma patients that looked like me, the same type of myeloma, because my type of myeloma at diagnosis was a little bit on the rare side. So I wanted to see what treatment helped them live the longest. Show me all the different treatment options and what did people get and how long did they live. And because that didn't exist, we decided to create HealthTree. That's really what I wanted.
We assumed that somebody would have already created this app, and we quickly learned that it didn't exist. In fact, only 8% of a patient's healthcare data sits inside the electronic health record, and Jenny's data sat in 11 different databases. And most of the information was inside of Jenny's head. So there's a lot of barriers and data silos and red tape that have prevented researchers and doctors and pharma companies from getting together and working with patients to accelerate a cure.
You know, there are all these stakeholders in trying to help the patient, and each one has their own compliance issues or regulatory issues or whatnot, but patients have no restrictions. Patients are the only ones that can gather their information and share their story with anyone they want.
We created HealthTree inside of a nonprofit because our only goal is a cure. We will never share our personal information or sell it that's entered into HealthTree. All the reporting that's shown to the researchers from the patients is anonymous. In HealthTree, you own your own data, and you can request to remove it at any time.
HealthTree has been a wonderful resource. It gives me a place where I could keep and access my medical records. It also gives me a list of individualized treatment options that I could discuss with my doctor. And finally, there's an online curriculum where I could learn about myeloma, and this way I could be an active member of my healthcare team.
Now I was putting myself back in charge by learning about my disease. I'm not scared anymore, and knowledge is power. We all need to help each other towards that cure.
One doctor said, you'll be on dialysis the rest of your life. And the other doctor says no. Well, I know who I want to believe, But I didn't know which one to believe. Do I ask a third doctor, is the best 2 out of 3, or where do you go from here? And I had no idea. And then HealthTree came along.
After 2 years of treatment, I'm currently in remission, but I credit a lot of that success to having good information and having a good care team and also having good data. But even with the portal that I have, it's not complete. And I'd love to have a better source to be able to put all my information into one integrated platform and be able to leverage that not only personally but also be able to have a better conversation with my physician and care team so we can continue that durable remission. And I think one of the ways to give back is to get my data in a platform like HealthTree so that the research community can use what they know about me for similar patients like me to just accelerate that cure.
A couple of the things that I really love about HealthTree, first of all, I love that it's mobile, so I can have it on my phone. Second of all, it gives me access to the clinical trials that are available that I would qualify for. The other component is the combinations where it shows the different drug combinations. So then it kind of gives you an idea of, okay, if that doesn't work, then there's other stuff that you can try. So it gives you hope, and it helps you have a more intelligent conversation with your doctor when you're talking about your treatment.
So now I can see what we're all learning together in the report section of HealthTree, like the types of myeloma that everybody has, or if somebody has it in their family history. I can also help myeloma researchers come to faster conclusions because I'm answering their survey questions and I'm joining studies inside of HealthTree. This can save them years and hundreds of thousands of dollars to perform research on my behalf. I can also find and chat with other myeloma patients with my same kind of myeloma with our twin machine technology, and this is exactly what I wanted when I was diagnosed. So please join HealthTree and share your myeloma story. And finally, we can make educated decisions about our care and get the help we need to navigate our disease while we accelerate a myeloma cure.